is Jose Ruiz, and I am a structural massage therapist, a personal trainer, and nutrition counselor. Well, my therapy is actually structural energetic therapy, so it's going to really help to alleviate problems in the body, restructure the body. So, very different than just a typical relaxation style massage. So, structural energetic therapy uses a combination of trigger point therapy, neuromuscular therapy, emotional releases, deep tissue massage, myofascial unwinding, basically a little bit of the top modalities for helping to eliminate pain from the body. And the goal is to have people rehab from their pain long term. Well, set therapy, we actually have a technique where we can release the body torsion that happens to a lot of people that allows the hips to come back in line. It also allows the spine to straighten back out, which everything flows up and down the spinal column. So it's one of the only modalities that can do that. Not even chiropractors use this technique. So when we can get the body into alignment and out of the what's called the core distortion, then the rehabilitation is possible long term because then the body starts to go back into a much straighter anatomical position. Stress gets taken off the joints, off the spine, off the nerves, so it's much more effective than just a traditional massage where everything might kind of get pulled back out of alignment depending on what the client is feeling. So set therapy is the only therapy that actually releases that core distortion. All right, so one of the other things that set therapy does is bring the body into balance completely. And the reason it's called structural energetic therapy is because it does deal with the emotions that get trapped in our body. So there's been plenty of evidence now that shows the body will store emotions. It'll store trauma in the muscles, so they're not just a memory in your brain. So a lot of chronic conditions that don't seem to be alleviated with body work can get relief through what we use as breath work and emotional releases that allow you to come back into that balance. So it gets released from your system completely, from the psyche. So things that cause anxiety, things that cause depression, those sorts of issues get treated really, really well with the therapy that the set work brings also. No, we do cranial structural work is the basis. So a lot of people confuse that with cranial sacral. Cranial sacral focuses within the box of the cranium and the sacrum, so just up and down the spine. With the cranial structural work that I do, it actually goes beyond that. So it's kind of outside the box of cranial sacral. Our techniques are a little bit more deep pressure. So cranial sacral is also very light on the technique. So since we're actually affecting the structure of the body, the cranial structural work that I do is a little bit deeper and broader than just the cranial sacral therapy. Well, set therapy is really effective for pretty much any sort of chronic pain condition. We have effectively treated TMJ disorders, scoliosis, nerve impingements, scar tissue around the body, herniated discs, migraine headaches, a lot of stuff. Because once the body starts to get that nice balanced structure again, you're actually able to eliminate a lot of the issues that come from an imbalance. All right, so that's going to be something that's very individual depending on what the client needs. But on average, if it's not a real chronic condition, then you could probably see some good results within the first 4 or 5 sessions. And anything more long term than that, we usually see some really drastic changes by usually 8 to 10 sessions. And the sessions are going to be anywhere from a little over an hour to about 90 minutes. There can be maintenance. I mean, we definitely suggest once you are symptom free for more than 4 or 5 weeks, then it's a good idea to start to come maybe every 2 or 3 months and then make sure everything is good. If your structure is holding well, then There's clients that just maintain with a massage once or twice a year, and they're good to go. Because obviously life is gonna, your body's always gonna be changing, so you won't feel the same pain that you used to. And in order to keep that up, it's just a really easy, once or twice a year, every 6 months, just kind of a tune up, and you're good to go.